Let's start with the bony landmarks of the radius and the general feature and the side determination. Again हमने इनके ऊपर ऑलरेडी एक रिकॉर्डिंग की हुई है, लेकिन मैं एक जनरल सी चीज़ बता दूं. लेट सपोज अगर वाइवा में या क्लिनिकल पॉइंट ऑफ व्यू से आपको कोई भी बोन रेडियस बोन दी जाती है और आपसे साइड डिटर्मिनेशन से मुराद कि आपको उसका साइड डिटरमाइन करना है, वेदर इट इज़ लेफ्ट और राइट, तो उसका एक बेस्ट तरीका ये होगा कि आपने कोई भी व्यू देख लेना है. मिसाल के तौर पे कोई भी व्यू से आप किसी भी एंगल से आप उसको होल्ड करते हो, तो आपने हेड ऑफ रेडियस जो कि मोर जो है वो मोर विजिबल एंड मोर कॉमन इज बेसिकली the long way. If you see the lower end, you will see the the projection, bony projection is the styloid process of radius, and it must be laterally. Okay, and finally the posteriorly, if you will see the anteriorly, this is the quite triangular and very smooth and expanded, but the posterior aspect have some grooves. तो ये इनके कुछ बोनी लैंडमार्क्स है जिनके बिहाफ पे अब नाउ लेट सपोज आई डोंट नो द वेदर इट इज लेफ्ट और राइट. ओके, मैं इसको ग्रिप करता हूँ किसी भी एंगल में, ठीक है, और मैं इसको प्लेस करता हूँ. इफ आई प्लेस, आई नो तीन चीजें मुझे पता होनी चाहिए. ये जो रेडियल ट्यूबरोसिटी है ये मीडियली फेस करे. दूसरी चीज मुझे ये पता है कि रेडियस बोन जो है वो लेटरल बोन ऑफ द फोर आर्म है, इट मस्ट बी ऑन द लेटरल साइड. ओके, और तीसरी चीज ये जो पोस्टीरियरली ग्रूव्ड हैं या पोस्टीरियरली जो ट्यूबरकल है, इट मस्ट बी ऑन पोस्टीरियरली ऑन द डोर्सल साइड. ओके, सो नाउ इफ आई प्लेस जस्ट like this, if I place on this, here I see the bicipital tuberosity, radial tuberosity is facing medially, so it is okay. The styloid process coming laterally, it's also okay. But if you see the posterior tubercle, जिसका नाम ही posterior tubercle है, वो anteriorly आ रहा है, so it must be posteriorly. Okay, so if I place it posteriorly, okay. Now if I see अब मैंने इसको posteriorly place कर लिया, but अगर मैं देखूँ तो styloid process medially आ रहा है और जो bicipital tuberosity है, radial tuberosity है, वो भी laterally जा रही है, जो कि ये गलत है. ठीक है, तो अगर मैं इसको राइट साइड पे प्लेस करूं, इफ आई प्लेस ऑन माय राइट साइड, इफ आई सी द बाइसिपिटल ट्यूबरोसिटी इज फेसिंग मीडियली, इट मींस ओके. द styloid process laterally, it okay, and the anterior surface and also the posterior tubercle is also on the dorsal side or posterior side. So here are some aspects which on the basis of these aspects you determine whether it is right or left. So we concluded that this one is your right radius. Okay, just after the side determination, now we are moving toward the clinical features, general features. So if you focus on the general features and the bony landmarks, you can divide the radius bone into three parts: the upper end, the lower end, and the remaining part is your shaft. So simply you can divide it, the upper end, the shaft, and the lower end. Okay, so let's target the upper end first. If you see the upper end, you will see a head, a rounded coin type structure. If I show you on this, this is your head of radius, superiorly having concave, and this concavity basically articulate with the capitulum to form the elbow joint. Okay, तो अगर आप इसको ऊपर से देखेंगे तो आपको एक concavity मिलेगी. Okay, और इसको साइड से अगर देखेंगे तो this is round basically. This is the head of radius. This is the circumference of radius which is covered by the annular ligament. Okay, so this structure you have a, this one is the, you have a head of the radius. Okay, and then you have a deltoid, sorry, not deltoid, but the bicipital tuberosity or radial tuberosity. Okay, so if I show you like this, okay, so now you can clearly see, because this is the right side of the radius, so you have to place on it right side. So you have a head of radius first, which is concave on the superiorly to articulate with the capitulum. Head of radius के नीचे बिल्कुल you have the neck of the radius, and then you have a little bit tubercle. You have a impression, what we can say a projection. You have a tubercle. This tubercle is the radial tubercle because it is present on the radius. Another name is the bicipital tubercle or bicipital tuberosity because of the insertion of the bicep brachii. Okay, the surface which you see from the anterior side is your anterior surface. All way you can see it has three borders, radius has three borders and three surfaces. So if I talk about the anterior border, this whole way coming from the bicipital tuberosity, lowering down and terminating toward the styloid process of radius, this whole structure is the anterior border, which is quite a ridge type structure. Okay, when you talk about the another one medially, so this is the medial side, all way coming from the again from the bicipital radial tuberosity, long way down, and it ends at the, this is the ulnar notch. This is named ulnar notch because the ulna fits, ulna articulate here to form the inferior radioulnar joint. Okay, so this is the medial border, and then finally if I turn around it, this is the posterior border. Posterior border commonly lower part में जो है more clarified होता है, more clear होता है, और secondly more defined होता है, because you will see some grooves and you will see some tubercle. This tubercle in between all them is the dorsal tubercle of the lister, जो कि हम lower end में पढ़ेंगे. Okay, so coming back to the shaft, you have a 3 borders. After 3 borders you have a 3 surfaces. The first surface that you can see is the anterior surface. Anterior surface is between the anterior border and middle border. Anterior और middle के बीच का जो भी surface area है वो आपका anterior surface है. Got it? Now coming toward the, this one is the medial and this must be the lateral. So now coming toward the lateral surface. If you talk about the lateral surface, this is the anterior border and this is your posterior border, और इन दोनों के बीच का जो भी surface है वो आपका lateral surface है. Okay, this is the, this whole surface area is your lateral surface. Or coming back to the neutral and then moving toward the posterior, ये आपका medial border है और ये आपका posterior border है. तो posterior border और medial border के बीच का जो भी surface area है वो आपका posterior surface में आएगा. तो after 3 borders you have a 3 surfaces. हम borders और surfaces इसीलिए भी पढ़ रहे हैं क्योंकि इनकी एक अपनी एक जो है recognition है. Different muscles are attached. Like if you talk about the anterior surface, there is a nutrient foramen, which is a clinical what we can say the bony landmark or representation of anterior surface. Okay, so 3 surfaces, 3 borders. Now moving toward the lower end. So if I show you the lower end, this part, if I show you the lower hand has the 5 surfaces. Number 1, on anterior side you will see the anterior surface which is triangular and expanded basically. तो ये आपका anterior surface है. Okay, this one is the lateral side. तो ये आपका lateral surface है. So if I move on laterally, this is the lateral surface which basically projects downward to form or to terminate at the styloid process of radius. Okay, coming back to the anterior, on this is the, if I turn around, this is the medial surface which is a representation or what we can say which has a notch which we call it ulnar notch. और यहाँ पे आपकी ulna जो है, if I show you, यहाँ पे आपकी ulna जो है वो articulate करती है in order to form the inferior radioulnar joint. Okay, तो this is the medial surface, anterior surface and lateral. और अगर इसको मैं बिल्कुल dorsally turn करूँ, on the posterior side you will see a tubercle in between the grooves. Grooves के बीच में एक tubercle है. Okay, this part is the dorsal tubercle of the lister, और इसके right और left side पे कुछ grooves हैं basically for the some extensor tendons. Okay, so 4 surfaces हो गए. Now finally you have a inferior surface. So if I show you, this is the inferior surface which you see from the inferior side. Okay, if you see the inferior surface, you have triangular, this part is the triangular and this part is the quadrangular. So if you see the inferior side, this triangular part is basically to articulate with the scaphoid bone which is a carpal bone to form the wrist joint, and this quadrangular part articulate with the lunate which is the second carpal bone. Okay, you have 8 carpals in your wrist जो कि हम wrist bone wrist joint के anatomy में पढ़ेंगे. Okay, so this triangular articulate with the scaphoid and the quadrangular articulate with the lunate to form your wrist radiocarpal joint basically. Okay, so you have 5 surfaces on the lower end, and this was all about the shaft. And now we are moving toward the muscles which are attached. So मैं क्विक रिव्यू दे दूंगा मसल्स को क्योंकि मसल्स के ऊपर हम ऑलरेडी डिस्कस कर चुके हैं. हेड ऑफ रेडियस पे एनुलर लिगामेंट होता है. ठीक है, नेक ऑफ रेडियस पे आपके पास क्वाड्रेट लिगामेंट की अटैचमेंट होती है. ओके, देन यू टॉक अबाउट द रेडियल ट्यूबरोसिटी जिसको बाइसेप्टल ट्यूबरोसिटी कहा था. तो यहाँ पे आपका बाइसेप मसल, बाइसेप ब्रेकियाई की इंसर्शन होती है. ओके, इफ आई मार्क विद द पेंसिल, देन इफ यू मूव just below to the insertion of the bicep muscle, here is the oblique cord is attached. Okay, now when you talk about the anterior surface, in anterior surface we have also some muscles. On the upper side we have a flexor pollicis longus, origin of the flexor pollicis longus. On the lower you have an insertion of pronator quadratus. Okay, when you talk about the anterior border, on outer part of the anterior border, here is the origin of flexor ditorum superficialis. Okay, so in anterior border outer part you have a flexor ditorum superficialis. On anterior surface, you have a flexor pollicis longus, you have a pronator quadratus. Okay. This is again the lateral. So if you move on the laterally, on lateral surface you have a 3 muscles. So if I place my 3 fingers on top you have a supinator muscle. Okay. In middle you have a pronator teres, and on the just above the styloid process of radius you have a brachioradialis. So this all the lateral surface, on top you have a supinator, in middle you have a pronator teres, and above the styloid process you have a brachioradialis. Okay. And when you move it on posterior side you have a 2 muscles. On the origin of the 2 muscles, the abductor pollicis longus, and just below it you have a extensor pollicis brevis. So this all about the muscles of the radius bone, and now we will do another recording on the ulna bone. So thank you so much.